Imagine possessing the power to shield yourself from one of the deadliest cancers affecting men today, prostate cancer. This silent killer claims thousands of lives annually, yet it's a disease that can be prevented if detected early. According to the National Institute of Health, prostate cancer is the most common cancer among men in the U.S. It ranks as the second leading cause of cancer-related deaths in men. The stark reality is that 1 in 8 men will receive a prostate cancer diagnosis in their lifetime. In 2024, more than 30,000 men lost their lives to it. In 2025 alone, over 100,000 men in the United States are expected to face this diagnosis. But here's some good news. Prostate cancer doesn't have to be a death sentence. If you recognize the early warning signs and take action, you can significantly increase your chances of survival. The problem is that most men ignore the prostate gland until it's too late. The prostate gland is a walnut-sized organ in males, located just below the bladder and in front of the rectum, surrounding the urethra, which carries urine and semen out of the body. It produces and secretes a fluid that makes up about 30% of semen volume, helping nourish and protect sperm cells during ejaculation. The prostate is also important for muscle contractions during ejaculation, emphasizing its vital role in reproduction and fertility. In this video, we'll reveal the 12 early signs and symptoms of prostate cancer that most people miss. These subtle clues can be easily overlooked, but recognizing them could mean the difference between life and death. So, if you're above 40 years of age or have a family history of prostate cancer, this video is a must-watch. First, what you need to know about prostate cancer. Despite its prevalence, many remain unaware of the early warning signs, leading to delayed diagnoses and more challenging treatments. Unfortunately, the silence surrounding prostate cancer only adds to its risks. When it comes to prostate cancer, did you know that age is the highest risk factor? The likelihood of developing prostate cancer increases significantly after age 50, and it's most common in men over 65. Here is the worst part. One of the stealthiest aspects of prostate cancer is that it can develop silently without any noticeable symptoms in its early stages. However, as it progresses, it can cause all sorts of symptoms, from urinary issues to discomfort in the pelvic area. Knowing these symptoms and understanding the importance of regular screenings can significantly increase the chances of early detection and successful treatment. Now, let's dive into the 12 early signs and symptoms that can help you detect prostate cancer even before conducting a medical test. After going through these 12 signs, we will also explain the common causes of prostate cancer so you can reduce your chances of having it in the first place. Make sure you don't miss out on that. Sign number 12, blood in urine. Have you noticed blood in your urine during urination? This alarming symptom, known as hematuria, is one potential warning sign of prostate cancer. It may appear as pink, red, or brown discoloration in the urine and, in some cases, can only be detected under a microscope. The presence of blood often signals advanced prostate cancer, making it super important to seek medical evaluation immediately. While other conditions like urinary tract infections or kidney stones can cause hematuria, it's vital not to dismiss this symptom. Early detection and treatment can help enhance outcomes, so stay vigilant and proactive about any changes in your urinary habits. Sign number 11, difficulty urinating. Do you have difficulty urinating? This symptom can show up in different ways. You might struggle to start urinating, experience a weak or interrupted stream, or feel like your bladder isn't fully empty even after you've gone. Here's the reason why. Prostate cancer can press on the urethra, making it harder for urine to pass smoothly. Sign number 10, inability to urinate while standing. Picture this. You go to relieve yourself but suddenly find it difficult or impossible to do so while standing. This unusual change can be alarming and disruptive, hinting at a more serious underlying issue. When prostate cancer affects the prostate, it causes the gland to grow and enlarge. This enlarged prostate can press against the urethra, blocking the flow of urine. As a result, some men may find it difficult to urinate while standing and may choose to sit down instead. Sign number 9, a noticeable burning while urinating or during ejaculation. Do you feel a burning sensation while urinating or during ejaculation? This discomfort, which can range from mild to severe pain, may indicate that the cancerous growth in the prostate is irritating or blocking the urethra and nearby tissues. Here's an interesting fact. This burning sensation is not only distressing but can also indicate inflammation within the prostate. While other conditions such as urinary tract infections or prostatitis can cause similar symptoms, it's important not to rule out prostate cancer. Persistent burning during urination or ejaculation warrants immediate medical attention. Sign number 8. Frequent urination, especially at night. Do you often find yourself waking up at night to use the restroom, leaving you tired and restless? Frequent urination at night, known as nocturia, can disrupt sleep and lead to chronic fatigue. While it's normal for bathroom visits to increase with age, a sudden or noticeable increase should not be ignored. Since prostate cancer causes the prostate gland to enlarge, it can put pressure on the bladder and urethra. This pressure may lead to an urgent need to urinate more often, particularly at night. You might wake up multiple times, disrupting your sleep and feeling increasingly exhausted during the day. But before we continue, if you're enjoying this video and want to stay informed about important health topics, make sure to hit the like button and subscribe to our channel. Your health is worth it. Sign number 7. Unexplained weight loss. Did you know that unexplained weight loss can be a subtle but concerning sign of prostate cancer? This symptom is often overlooked since it can be linked to other factors like stress or changes in diet. However, if weight loss happens without any intentional changes to your eating or exercise habits, it's important to pay attention. Prostate cancer can cause unexplained weight loss, particularly in the advanced stages when the cancer has spread to other parts of the body. This occurs because the body's increased energy demands and the cancer's effect on metabolism can lead to significant weight loss. Sign number 6. Pain in the bones. Another concerning symptom to watch out for is pain in the bones. Often, this pain is persistent and not linked to any obvious injury. Here's an explanation of why this is significant. As prostate cancer progresses, it can spread to the bones, causing considerable discomfort. This type of pain is typically felt in the spine, hips, or ribs and can range from a dull ache to a sharp, stabbing sensation. The interesting part is that bone pain associated with prostate cancer doesn't go away on its own and can be a sign that the cancer has reached an advanced stage. Sign number 5. Fatigue. Do you always feel tired, even on days when you haven't been busy? This could be a subtle sign of prostate cancer. The fatigue may build up gradually or suddenly hit you with full force. Fatigue in prostate cancer isn't just about feeling sleepy. It's an unrelenting exhaustion that doesn't improve with rest. Here's the worst part. Cancer-related fatigue is often more severe than the typical tiredness you might feel after a long day. It's caused by the body's response to the cancer itself, the energy demands of tumor growth, and sometimes as a side effect of treatment. Sign number 4. Blood in semen. Imagine the shock and worry of discovering blood in your semen. This unsettling situation can leave anyone feeling vulnerable and anxious. Known as hematospermia, blood in semen can be linked to prostate cancer. As the cancerous growth within the prostate disrupts the delicate tissues and blood vessels, this intrusion can lead to blood leaking into the semen, causing a pink, red, or brownish discoloration. Hematospermia can also occur after prostate cancer treatments like radiotherapy or surgery. However, if you notice this symptom frequently, consult your healthcare provider for a thorough evaluation. Sign number 3. Weakness, numbness, or tingling sensations in the legs or feet. Did you know that prostate cancer can sometimes cause symptoms that seem unrelated to the prostate gland? One such symptom is weakness or numbness in the legs or feet. This can occur if the cancer spreads to the spine, putting pressure on the nerves that control the legs. When this happens, men may experience weakness, numbness, or tingling sensations in their legs or feet, making it difficult to walk or maintain balance. In some cases, this symptom can be so severe that it leads to paralysis or loss of bladder and bowel control. Sign number 2. Pain and discomfort in the pelvic area, lower back, or upper thighs. The human body is a complex network of interconnected systems where issues in one area can affect the whole. In the case of prostate cancer, pain and discomfort in the pelvic area, lower back, or upper thighs highlight how interconnected the body truly is. When prostate cancer spreads, it doesn't only affect nearby areas, but can also impact the bones and lymph nodes. This aggressive spread triggers inflammation and swelling, which puts pressure on sensitive nerves. As a result, pain radiates from the pelvic region to the lower back and upper thighs. Sign number 1. Erectile dysfunction. Having trouble maintaining a steady erection? Erectile dysfunction or impotence is the inability to achieve or maintain an erection firm enough for satisfactory intercourse. While it can be caused by various factors, it can also be a sign of prostate cancer, particularly when it occurs without an obvious cause. Here's the catch. Prostate cancer treatments such as surgery, radiation therapy, and hormone therapy can damage nerves and blood vessels that control erections. This can lead to erectile dysfunction or ED, even if the cancer itself isn't directly causing it. So, what about the causes of prostate cancer? Understanding them can greatly increase your chances of preventing this serious disease. Let's explore what they are. What causes prostate cancer? Prostate cancer is a complex disease with several contributing factors. At its core, it occurs when changes happen in the DNA of normal prostate cells. These changes can occur during a person's lifetime or be inherited from their parents. Here's an interesting fact. Inherited gene mutations can contribute to up to 10% of prostate cancers. Genes like BRCA1 and BRCA2, which are commonly associated with breast and ovarian cancers, can also increase the risk of prostate cancer. On the other hand, acquired mutations occur randomly as cells divide and copy their DNA. These mutations can lead to uncontrolled cell growth, forming a tumor. Think of your DNA as a set of instructions for your cells. When there's a mistake in these instructions, it can cause cells to grow out of control, leading to cancer. But that's not all. There are other unsuspecting factors that can increase your risk of developing prostate cancer. Let's explore them. First, obesity and diet are other factors to consider. Men who consume a high-fat diet, especially one rich in red meat and high-fat dairy products, may have a higher risk. On the other hand, diets high in fruits and vegetables may lower the risk. Environmental exposures and lifestyle choices, such as smoking and alcohol consumption, can also contribute to the risk of developing prostate cancer. Race and ethnicity also play a role. African American men have a higher risk of developing prostate cancer compared to men of other races. Additionally, men with a family history of prostate cancer are at a greater risk. That means if your father or brother has had prostate cancer, your risk is more than doubled. However, understanding the causes and risk factors of prostate cancer isn't enough to keep you safe from this disease. Let's find out the best way to prevent prostate cancer. How to prevent prostate cancer? While there's no surefire method to guarantee immunity from prostate cancer, there are several lifestyle changes and health-conscious habits that can significantly reduce your risk of developing the disease. 1. Embrace a healthy diet. Since you are what you eat, it's advisable to opt for a balanced diet packed with fruits, vegetables, whole grains, and lean proteins that can do wonders for your prostate health. Here's a fun fact. Incorporating foods rich in lycopene, like tomatoes, and omega-3 fatty acids found in fatty fish may provide an additional layer of protection. 2. Maintain a healthy weight. Did you know that keeping your body mass index, BMI, within a healthy range can lower your risk of prostate cancer? In fact, shedding extra pounds and avoiding obesity can further boost your chances of preventing prostate cancer. 3. Stay physically active. A sedentary lifestyle is a major risk factor for many diseases, including prostate cancer. This makes staying physically active super important for your health. Start by including regular exercise in your daily routine. Aim for at least 150 minutes of moderate aerobic activity each week to help lower your risk of prostate cancer. 4. Go for regular checkups. As mentioned earlier, the best part of being proactive about your health is the peace of mind that comes with early detection and treatment. Consult your doctor to determine the right age to start annual prostate screenings based on your individual risk factors. Remember, early detection is key to effective prostate cancer treatment and a better quality of life. Don't ignore the signs stated in this video and listen to your body so you can take action when something feels off. Make sure to schedule regular checkups with your healthcare provider, maintain a healthy lifestyle, and stay informed about the risks and symptoms of prostate cancer. And if you found this information helpful, don't forget to like, subscribe, and share this video with your friends and family to spread awareness about prostate cancer. Now here's an intriguing question for you. What steps are you taking to stay proactive about your health? Comment below, and let's start a conversation.